Let's do some questions. IELTS questions, practice questions with critical thinking, learning, test-taking strategy. Stick around and watch part 2 of the series. Great question. How do we answer question? Strategy. Read it from the back and look for what you are being asked to do. Then read the rest of the case. Pay attention to the buzzwords. Use these 3 things to rewrite the question. When you rewrite a question, spend some few seconds, bring out your content. Your content will help you look for answers you already know. I'm looking for these specific answers. And then I compare this content to that, and I strike every answer choice down based on my content. I avoid certain words like none, all these things, just a couple of test-taking strategies. So what is the problem? It's a select or apply being asked. What is the case? 70-year-old, age is important. Present to the eye clinic, complain of inability to do what? See object when facing the object. And the images are what? Distorted or are buzzwords. Client can see from the side, can see from the side of the eyes. The next note that the cause of this client condition include what? This is the patient. There is an object. Can't see straight from the patient. He has to turn the head and see from the other side. Turn the head and see. That means the peripheral vision is intact. Central vision is lost. What causes central vision? It's macular degeneration. When you have eye surgery or any case involving the eyes, write this down. Retina, glaucoma, cataract, and macular degeneration. This is glaucoma, peripheral vision lost, macular degeneration, central vision loss, is the scarring of the lens, and this is acute problem. Then I said, what is the risk factor? Well, age is bigger one. If you have family history, it's a problem. Hypertension is an issue. Smoking is bad. And vitamin. Right. So all those things causes effect of macular degeneration. These are causes just to give you content. First one, down. Number 2, which order you need to question or clarify for client. I have clozapine and my white count is 9,000. You know this causes agranulocytosis. This is 9,000. It's okay. Spironolactone, I spare potassium. That means I increase potassium. 3.5 is not that high, so I don't need to question it. Ziprasidone on MI 3 weeks ago. Ziprasidone, this causes QT prolongation. So somebody who has heart attack 3 weeks ago is not ready. The heart can go into arrhythmia, so we should stop the ziprasidone. Bumetanide and BMP of 500. Think about it. BMP greater than 100 is CHF. If you have CHF, I give you diuretic, so you should be fine. So this is the only one she should clarify. So let it apply. This is content I want to give you guys in case you see it somewhere. Which of the following prescription the nurse should anticipate? The nurse is caring for a client, potassium 6. Keyword. My ax is 6, potassium, action. Then you tell yourself, bring your content. Potassium is outside the cell here, and it's 6. We got to drive it inside. It's more inside the cell than outside. Why can I put potassium inside the cell? I need insulin. Insulin is number one that pushes potassium inside the cell. So insulin go. Insulin has to be regular insulin, not NPH, not Lesopro, nothing, not long acting, regular insulin. So 10 units of insulin. Because I'm giving insulin, your sugar will drop. So I need to give you glucose. So D50 is okay. This should say an amp. And then if your potassium is high, I need to stabilize your heart. Calcium stabilize the heart. It prevents the excitability of the heart, so that the effect of hyperkalemia will be minimized. So this is fine, 1 gram. Albuterol is another agonist that will drive potassium inside the cell. So albuterol, you have to know that. It's one of them. Furosemide, diuretic, you pee everything out, you lower your potassium. So that's good. Case isolate go into your GI tract, bind to the calcium, and the potassium is a binder, and let you poop it out, stool. If you have obstruction, you can use it. So you got to make sure patient has no obstruction. Sodium bicarb, all these means is base. I'm making you alkalosis. Alkalosis means I have too many OH outside the cell. Your body will push H plus to balance it out. If I put H plus, I got to get H plus. So that pushes potassium inside the cell. So bicarb can be used for potassium. Another information is dialysis. You can also do dialysis. So these are all the things you do for hyperkalemia. Prioritization question. Who do you see first? For client, be sharp. That's all. Pneumonia, infection, I expect temperature. I don't see any shortness of breath or respiratory issues. We good. Hyperthyroidism, everything is supposed to be high except your weight. That goes down. At rate of this, suspected. ALS, amyotrophic sclerosis, amyotrophic lateral sclerosis, inability to cough. This is an airway problem. They have ascending, they have weaknesses that involve their neuromuscular junctions and nerve problems. So the weak airway issue, they have to be intubated and all those things. So the most important problem is airway cough. If you see my patient, SAT of this, COPD, sometimes people live at 90 or 89. COPD patient with a SAT of 99 or 100, I'm worried about him. He's going to lose the drive of respiration. So who do you see? Number 3. So which of the following actions are appropriate? I'm looking for appropriate action. A nurse is caring for a client with hepatitis A infection who is what? Incontinence. Being asked is what? Action that is appropriate. In the case, I have FA, but not just FA, I have incontinence. So if I have incontinence, it changes everything. FA is standard precaution. But now I have incontinence, contact take precedence. So contact precaution is the best. If they don't have incontinence, you just do standard precaution. So A is the right answer. Number 6. Select or apply as usual. This is all content to teach you content. Priority. A nurse is caring for a client, prescribe this medication, nitrofurontion, for recurrent UTI. Recurrent UTI. Keywords being asked is what? Nitrofurontion. And then what is the problem? Teaching that is effective and a priority. You have to know this medication. So I put some of the key side effects. Your test, whenever you see antiacid, is a bad thing. So avoiding them is good. This medication comes as a capsule, therefore don't crash it. Nausea and vomiting, you need to call me. This is common side effect, so this is wrong. This is number one side effect. Bad. If they have persistent cough, they're having pulmonary fibrosis, you got to call me. And you should not drink alcohol. So these are our priority teaching. Number 7. Which teaching is effective? Client is caring for, a nurse is caring for a client diagnosed with a kidney stone due to what? Calcium oxalate. So A, effective. The case is calcium oxalate stone. So what do I need to do? Provide teaching that is effective. What do you think? Don't eat oxalate. That's all. So which one is effective? Carrot does not increase oxalate, so it's not. Avoid rhubarb. This is number one cause calcium oxalate. Spinach has a lot of oxalate in it. Wheat bran, oxalate, and peanuts, oxalate. So these are all, you need to avoid them. That's the answer right there. Next question. Select or apply. Same thing. Which medication should the nurse question? I need to question something. A nurse is caring for a client with a creatinine of 2.3. 2.3 creatinine, I know it's a kidney issue. Therefore, anything that affects my kidney is my answer. Vancomycin, number one, nephrotoxic. Aminoglycoside, and number one, nephrotoxic in their group. Okay, it causes autotoxicity and hepatotoxicity. Acetaminophen does not affect your kidney that much. Ketorolac. Okay, this is an NSAID, so ketorolac. It's an NSAID. Ketorolac, NSAID. That can also cause the kidney problem. Its friend, ketorolac, is indomethacin. Bad NSAID. These two are bad medication. They are bad NSAIDs. They affect the kidney, but they're very good. They're powerful NSAIDs. So these, we should question all of them, except acetaminophen. Next question. Which teaching is appropriate? Appropriate teaching. And then it's caring for a client with what? Uric acid stone. Keyword, uric acid. How do you avoid uric acid? You got to avoid certain food. Spinach is not one of them. Leafy vegetable is not. Sardine, excellent. A lot of uric acid, red meat, and shellfish. So that one. You should avoid it. Same thing. What is the priority during the emergent phase? Select or apply. A nurse is caring for a client, 70% of total body surface burn. Which one is important? In the emergent. Emergent, we have acute, okay, and in the late stage, basically where we reconstructive state. That's all we're doing for that stage. So these are the stages of burn and what you do with it. So emergent, acute, and then sometimes we call rehabilitation stage. What you do in emergent is mostly resuscitation. And the key number one is airway. Manage their airway and give them fluid. Acute phase, basically they're giving you back the fluid. This happening 48 hours later. This is the injury to 48. 48, they're basically giving you all the fluid, you're giving them back. You provide some nutrition and you take care of their wound. In rehabilitation, you're just helping reconstruction of all the scar tissue. skin graft and all those things usually okay. And you bring them back into their normal state. So they are undergo multiple stages. So acute phase, once again, it's mostly, that's where you do ABC, airway, breathing, circulation, make sure you're giving them resuscitation. No, the emergent phase, emergent phase, you airway, breathing, resuscitation, and everything, you take care of that. Acute phase, all the fluid you're giving them, they will give it back to you. So what is the priority in emergency case? Airway and resuscitation. Skin graft, no. Wound care, no. Nutrition, no. So these are what is needed in emergent phase. Number 11. Which of the following is the most important thing to do? A nurse is caring for a client with recurrent AFIB who need cardioversion. Which one is the most important? So I have AFIB. It's not getting better. You need to do cardioversion. This question is tricky. I need a consent. I need to sedate you. I need to have a cardiac monitor. I need to turn on the sync mode. Which one is the most important? The way I see this question is, which one is going to kill you? If I don't give you a consent and I do the procedure, you'll be fine. You're not dead. You just probably will sue me. If I don't give you sedation, I'm being non-human, right? I'm being mean. I need a cardiac monitor to monitor you. So still, it's not going to kill you. If I did not put on the sync mode on and I shock you, it will be R on T. This is a lethal rhythm. And this, you can die. So which one is most important? I will put on the sync mode. The sync mode is the most important. It depends on what kind of answer choice you get. They can trick you. They can take the sync mode on, or they can take it off and you don't see it, but they give you other choices. Consent, sedation, and cardiac monitor. I will go for consent. If I don't see the sync mode on, you have to consent the patient to do a procedure, and that's like, no. You cannot do a case on the patient without consent. But if there's an answer choice, say turn the sync mode on, I'm taking that one. So that's a hard question. It's a test-taking strategy. Which teaching is effective? Select or apply, right? Effective. Keywords, buzzword. And then she's caring for a client with stiff fib fracture who had cane as an assistive device. So effective, and I'm using cane. All you have to know is how do you hold the cane. The cane should be held on the unaffected side. You move the affected side and the cane together, then you move your unaffected side. And you always have a 2 point on the ground. Your elbow should be flexed to 20 to 30 degrees or 35 degrees. Okay? Greater trochanter is where you measure the height. So cane on the right side, pay attention when they give you, they try to screw you up. I'll say left, so the opposite side unaffected is right, so this is right. Elbow, this is 45 is too big. We want 20 to 35. Move the cane and the left leg. Left leg is affected leg together. Cane level with the greater trochanter. That's where we measure it. So this is it. This is just a fundamental to give it to you. So 1, 3, 4. If you don't know it, just pick those that you're confident on. To another question. Select or apply. Which of the following action need immediate intervention by the charge nurse? A nurse is caring for a client with SVT who need adenosine. So what is being asked? Immediate intervention. And what is the problem? Adenosine. And I provide my teaching and say, adenosine is used for SVT, rewriting and giving my content. Okay. It has to be pushed really fast, over 1 to 2 seconds. And it should be close to the vein to be close to IV, close to the heart. And then you flush it, right? The first dose is 6 millimeters and 6 milligrams. So that's good. The dose is given over 15 seconds. No, it's too long. Fast. 2 seconds. You got to flush it with saline, 20 cc. Inform the client they're going to have flushing in the face. And the IV side is that the heart elbow is closer to the heart. So those are the key. 6 milligrams followed by 12 milligrams. If it doesn't respond, the dose is given very fast, over 1 to 2 seconds. Flush it with 20 ml of saline. Inform the client they're going to have flushing, and then IV side close to the heart as much as possible. So that's the way you do this question. So 2 more. What do we have here? Select or apply again. A nurse is caring for a client prescribed warfarin and digoxin for DVT and heart failure. Which of the following the nurse should clarify? So what is being asked? I have a heart failure, I have digoxin, and I have warfarin. Which of these information I need to clarify? Heparin drip, yeah, you can't start warfarin without heparin drip. So this is good. Warfarin, 2 to 5 milligrams twice a day. It's usually taken once a day. So this is wrong answer. So he said, which one you should clarify? So this is good. I don't need to clarify, but this is I need to clarify. Warfarin, 20 a dose, 2 to 5 milligrams daily. Yes, I don't need to clarify this. The digoxin is given by weight. So this is the usual weight, 25, 35 microgram per kilo based on your weight and every day. So every day somebody get like that. So it depends on their weight. So once again, what he's asking for you is which one need clarification. This does not need clarification. This does not need clarification. This is not this. This is the dose is in weight per kilo. And this is the daily dose. It depends. You can get 3 milligrams, 2 milligrams, 5 milligrams daily. And it's usually taken at night. Okay. And the last one. A nurse is caring for a client prescribed what? Digoxin for a heart failure. Client has history of what? Hypertension. Which of the following teaching is effective? So backward, SATA, effective. I have CHF, giving digoxin, and hypertension. Which one is effective? That means I'm dealing with digoxin question, right? What should I avoid? Low potassium, high calcium, low magnesium. Okay, that's key, right? I should avoid it, right? So local rice will cause low potassium. Therefore, this teaching is good. I will avoid it. I will avoid the thiazide. This is a calcium channel blocker, which will increase my calcium, so I should avoid it. I'll call my ophthalmology with a vision change. Vision's change is toxicity. You should call the doctor, MD. You should not. This is not effective. I will hold my dose if my heart rate is what? 61. I assume that this is an older patient, so I got to give you. But 61, the base is less than 60. That's heart rate for older patient. 70 for child, 90 for neonate. So this one is still normal. So which one teaching is effective? It's 1 and 2. So this is the end of it. I hope you get something out of it. This is how I do questions, very key, highlighted, high yield facts for your test. Yeah, you should check the series. I did another one before. Look at the question, see if you can answer it differently, and send me a note and let me know what you think. And then wish you best. Good luck. Keep charging. All the best of luck.